On a cold winter night, 8 February 1955, the wards of London's Royal Free Hospital buzzed with an inexplicable panic as dozens of patients began to convulse, vomit, and lose consciousness for no discernible reason. Within hours, the mysterious illness had spread beyond a single ward, and by the end of the week, more than 300 men, women, and children were bedridden with the same baffling symptoms. No toxin, no virus, no visible cause could be found, and the city's most seasoned physicians were left staring at a wall of unanswered questions. The Royal Free, founded in 1856 as the first free hospital for women, had by the mid-20th century become a beacon of modern medicine in post-war Britain. Its corridors were still echoing with the optimism of the newly created National Health Service, and its laboratories were equipped with the latest microscopes and spectrometers. Yet the events of early February would test the limits of science and reveal a darker side of human psychology that would later be labeled mass hysteria, or what modern scholars prefer to call a collective stress reaction. The first reported case involved a 26-year-old clerk admitted for a routine abdominal surgery. Within 45 minutes of anesthesia, he erupted in a violent bout of nausea, his skin turning an alarming shade of pallor, his eyes wide with terror. Within the next hour, 2 more patients in the adjacent ward displayed identical signs: sudden loss of appetite, intense abdominal pain, and an unrelenting urge to vomit, followed by a deep, unresponsive stupor. By the time the night shift arrived, the pattern was unmistakable. Nurses described a wave of panic, rippling through the ward with patients clutching at their throats and screaming about an invisible poison. The hospital's senior medical staff, led by Dr. Harold Stokes, the chief of internal medicine, launched an emergency investigation. Blood samples were sent to the Royal College of Pathology, urine was tested for heavy metals, and a full sweep of the hospital's water and ventilation systems was ordered. The laboratory results were perplexingly uniform: no bacterial growth, no viral particles, no trace of cyanide, arsenic, or any known toxin. Even the autopsy of the first patient who succumbed, a 62-year-old man with a history of hypertension, revealed nothing beyond mild congestion of the lungs and a stomach lining irritated by acid, findings that could be explained by stress alone. The mystery deepened when the illness spread beyond the Royal Free's confines. Reports surfaced of similar symptoms at a nearby maternity clinic, at a private practice on Oxford Street, and even among some staff who had never set foot inside the hospital. Over the next 2 weeks, the number of afflicted individuals swelled to 312, with a striking predominance among women and adolescents. The symptoms remained consistent: sudden nausea, profuse sweating, abdominal cramping, a sensation of tearing in the throat, and, in severe cases, a brief loss of consciousness followed by a slow, trembling recovery. No fever, no rash, no lasting organ damage, yet the sheer terror of the episodes left a psychological scar on every witness. The Royal Free's Board of Governors convened an emergency committee that included neurologists, psychiatrists, and epidemiologists. Their first hypothesis centered on a possible chemical agent, perhaps a contaminant in the hospital's newly installed gas lines or a pesticide used in nearby construction. Engineers inspected the gas supply, and chemists ran gas chromatography on every inhaled substance within a 5-kilometer radius. All tests returned negative. A second theory posited a viral outbreak, perhaps a novel enteric virus transmitted through food. A thorough audit of the kitchen supply chain found no spoiled food, no breaches in hygiene, and the viral cultures remained sterile. When the physical investigations failed, the committee turned its gaze inward, toward the mind. Dr. Evelyn Morris, a psychiatrist with a reputation for pioneering work on psychosomatic illness, presented a daring suggestion. The cases might represent a psychogenic illness, a manifestation of collective anxiety amplified by the post-war climate of rationing, housing shortages, and the lingering shadows of the Blitz. We are witnessing a modern incarnation of what 19th-century physicians called hysteria, she wrote in her report, but now it is dressed in the language of toxins and disease, feeding on the uncertainty of a society in transition. To test this hypothesis, the hospital instituted a controlled environment. A small, isolated ward was designated as a clean zone, with no staff members who had previously tended to affected patients, and all supplies were double-checked for contamination. Over a period of 10 days, no new cases emerged in this ward, even though it housed patients with similar underlying conditions. Meanwhile, in the main building, the number of new admissions with the syndrome began to decline as word of the investigation spread through the local press. The pattern suggested that the fear of the unknown, rather than an external agent, was the catalyst. The final piece of the puzzle came from the autopsies. Dr. Stokes, determined to leave no stone unturned, performed a full post-mortem on the 2 patients who had died despite intensive care. Histological examination of the brain revealed no signs of inflammation, no ischemic lesions, and no abnormal deposits. The gastrointestinal tract showed only mild inflammation consistent with acute stress. The heart tissue was unremarkable. In his concluding remarks, Dr. subscribe to the Autopsy Files for more stories like this.